Hi, I am Dr. Ashish Talukdar. Today I am going to discuss a very high topic for USMLE Step 1 exam. There is a very much high possibility that you will face this type of questions in the USMLE Step 1 exam. Okay, so let's start. A 36-year-old woman is admitted to the hospital because of bleeding in the upper GI tract for 4 hours. 3 months ago, she was hospitalized for 20 days for treatment of necrotizing pancreatitis secondary to cholelithiasis. 4 weeks ago, she was admitted for a similar episode of bleeding. Her temperature is 37.3 degrees Celsius, pulse is 110, so tachycardic blood pressure is 110 by 70. The abdomen is soft with active bowel sounds. Endoscopy shows bleeding from gastric varices. Okay, so bleeding from gastric varices. The bleeding resolves with the conservative treatment. Which of the following is the most likely cause of the bleeding? So before going to the answer, you should have the core knowledge, the foundational knowledge of portal vein formation. You have you if you have the knowledge how the portal vein is formed, you can easily pick the right answer in the exam center or exam hall without dealing uh, very much time. Okay, so before going to the answer, I want to share how the portal vein is formed in a very easy way, so you can pick the right answer in the exam. Okay, so think this is the liver. Okay, this is the liver, and this is stomach, and this is splenic vein. Okay, this is splenic vein. So from splenic vein, the gastric vein, small gastric vein, drains into splenic vein. Okay, and from upper part, the esophageal vein comes down, and there will be anastomosis with the splenic vein. Sorry, the gastric vein, and from the lower small intestine, there is coming inferior mesenteric vein. This is inferior mesenteric vein, and also come superior mesenteric vein from the intestines. So the proximal part of the small intestine, there is coming superior mesenteric vein. This is superior mesenteric vein. This is inferior mesenteric vein. Okay. This is splenic vein. This is gastric vein. This is esophageal vein. So the gastric vein drains into the splenic vein, and inferior mesenteric vein also drains into the splenic vein. Then is this splenic vein and the superior mesenteric vein forms the portal vein. Okay, so this is portal vein. This is portal vein. This is liver. This is stomach. So the portal vein is ultimately formed by superior mesenteric vein and the splenic vein. You know that there is a pancreas. Here there is a pancreas. Okay, there is a pancreas. There is pancreas, and the splenic vein form the bed of the stomach. So these patients have recurrent episodes of pancreatitis, and 20 days ago the patient has necrotizing pancreatitis. So if the patient has necrotizing pancreatitis, that means the pathology is here, the pancreas. If the pancreas is necrotizing, so this will definitely affect the splenic vein. Okay, so it will destruct or erode the splenic vein. So if the splenic vein is eroded or destructed, so it cannot drains the blood into the portal vein. Okay, this can not into the portal vein, so it backflow. The blood flow is backflow. Okay, so there is bleeding from the gastric varices. This here, from this here. Okay, from this here there is bleeding from this here, because the pancreas is eroded or destructed. That's why splenic vein, splenic thrombosis occurs or something else. That's why the blood is backflow, and the gastric veins, there is bleeding from the gastric varices. Okay, you can understand. So what will be the answer? The correct answer is splenic vein thrombosis. What are the other options? uh, Alcoholic hepatitis, there is no something else. There is nothing mentioned about the patient is taking alcohol. And in case of alcoholic hepatitis, this is a chronic conditions, and patients should have jaundice. Okay, cirrhosis of liver, this is the main differential of these questions. Okay, you should have difference in the example. This is clinic vein thrombosis or cirrhosis of liver, because in case of cirrhosis of liver, this here, in case of cirrhosis of liver, there is a backflow, and there is a bleeding from the gastric varices or from the esophageal gastroesophageal varices. Okay, so in case of cirrhosis of liver, there is a possibility of bleeding from gastric varices, but in case of cirrhosis of liver, it's a chronic condition, and the patients have other symptoms. Okay, due to hyperestrogenemia, like spider nevi, Dubrian contracture, or blah blah blah. Many condition, you know that. So it should not be cirrhosis of liver. Fatty infiltration of the liver. It is also a chronic, very chronic condition, but this question is saying that this is an acute condition. And hepatic vein thrombosis is also called Budd-Chiari syndrome. In case of Budd-Chiari syndrome, patients, uh, the patient should have right upper abdominal pain, because this is due to the hepatic vein thrombosis. Hepatic vein thrombosis. Okay, and the patient should have jaundice. Okay, so it should not be hepatic vein thrombosis. So the correct answer is splenic vein thrombosis, and you should have the fundamental knowledge how the portal vein is formed. If you have the knowledge, you can easily pick up the right question, right answer in the exam. I hope this video will help you. Please subscribe my channel and hit the like buttons. Thank you.